Chapter 14. Cancer and Dentistry. There is a common procedure used by dentists that most of them will tell you is completely safe, despite scientists warning about the dangers for over 100 years. Each day in the United States, 41,000 of these procedures are carried out upon patients. The procedure is a root canal, and over 25 million are performed in the United States each year. The American Dental Association claims that root canals are completely safe, but there is no proof in the form of research or published data that back these claims up. Such teeth are essential dead rotten teeth that have the potential to become incubators for toxic anaerobic bacteria. Under certain conditions, they can make their way into your bloodstream, which in turn can cause serious conditions, sometimes quickly and sometimes years later. Many of such teeth look fine and feel fine for a long time, which make any disease harder to trace or to trace backwards. Teeth are made of the hardest substance in your whole body, and the roots of every tooth descend or ascend into your jawbone. Dr. Weston E. Price was a dentist and researcher that traveled around the world in order to study teeth, bones and the diets of native populations living without the benefit of modern food. Dr. Price had been treating persistent root canal infections and became suspicious about root canal teeth still remaining infected in spite of treatment. One day he recommended that a woman, in her wheelchair for 6 years, have her root canal tooth extracted, although it appeared to be fine. After agreeing, he implanted the tooth under the skin of a rabbit. The rabbit developed the same arthritis as the woman, and the rabbit died from the infection 10 days afterwards. The woman, free from her toxic tooth, recovered from her arthritis and could now walk without any assistance. Dr. Price discovered that it's impossible to sterilize a root canal tooth. Then he went on to show that some chronic degenerative diseases originate from root-filled teeth, such as heart and circulatory diseases. He found 16 causative bacterial agents for the conditions, and there were correlations between root-filled teeth and diseases of the joints, brain and the nervous system. He wrote 2 books in 1922, but his work seemed to be buried. Dr. Meinig, a captain in the United States Army during World War II, moved to Hollywood afterwards to be a dentist for the rich and famous. He eventually became a root canal specialist, becoming one of the founding members of the American Association of Endodontists. In 1993, he published a book entitled The Root Canal Cover-Up. Dr. Price identified as many as 75 separate accessory canals in a single front tooth, and that microscopic organisms move in and around these tubules. When a root canal is performed, the dentist hollows out the tooth before filling it with a substance, gutta perca, which cuts off the tooth from the blood supply. In the tiny tubules, bacteria which are cut off from their food supply hide where they are safe from the body's immune system, as well as from antibiotics. These organisms change into anaerobes that produce toxins. These can migrate into surrounding tissue via the bloodstream. Dr. Price also found that root canal fragments from a person that had suffered a heart attack, when implanted into a rabbit, would cause a heart attack in the rabbit. Other diseases were more than 80% transferable to the rabbit when tested. Chronic degenerative diseases including heart disease, kidney disease, arthritis, joint and rheumatic diseases, neurological diseases including ALS and MS, autoimmune diseases including lupus. Dr. Robert Jones, a researcher, found a relationship between root canals and breast cancer. In a 5-year study of 300 breast cancer cases, he found that 93% of women with breast cancer had received root canals, and 7% had other oral pathology, and that tumors in the majority of cases occurred on the same side of the body as the root canal or other oral pathology. Dr. Joseph Feisels reported from Germany that in his 40 years of treating terminal cancer patients, 97% had root canals performed on them. The Toxic Element Research Foundation, TERF, used DNA analysis to examine root canal teeth, and they found bacterial contamination in 100% of samples tested. The bacteria included 5 different types: 4 that can affect your heart, 3 that can affect your nerves, 2 that can affect your kidneys and your brain, and 1 that can infect your sinuses cavities. 400% more bacteria were found in the blood surrounding the root canal tooth, and an even higher bacterial count was found in the bone surrounding the tooth. In Britain, researchers have warned about the health risks associated with fillings, saying that people with more than 8 fillings have an increased chance of brain, heart and kidney disease. Metals within tooth fillings could raise the blood mercury levels by 2.5 times, according to the University of Georgia. Fillings are usually made up of a mixture of mercury, silver and tin, and Britons on average have 7 fillings each. Mercury makes up about 50% of the compound called dental amalgam. More than 1 million children under the age of 5 in Britain already has at least 2 fillings. Dr. Yin from the university analyzed data from almost 15,000 people to identify a link between dental fillings and potential mercury poisoning. Individuals with more than 8 fillings had around 150% more mercury in their blood.